with these appliances, and I have never had a report of root resorption or devitalization of teeth. We do have several studies that have been done on it, which you might refer to. There have been studies done on possible root resorption, which was negative. Other studies on the Night Guide and the Occlusive Guide. So go on to our website. We have about 80 monographs on there that might be of interest to you. So anyway, appreciate your attention.
Thank you.
And time.
How does it end snoring?
How does it end snoring? Actually, let me just go through and see if we make two snoring appliances. Snoring occurs because the mandible relaxes, and especially in overweight people that have large neck sizes, particularly men. Sometimes if they have a cocktail before they go to bed at night, it relaxes the muscles and the mandible slips back. And since the tongue is attached to tubercles on the lingual of the mandible, it allows the tongue to go back and partially closes the pharynx, and that allows vibration of the uvula. Now, if it closes completely, it blocks the air passage completely, and that's called an apneic event if that lasts 10 seconds or longer. Some people have a couple hundred of these at a night, time sleep, in 8 hours, and they lose oxygen in the body. And during the daytime, they feel sleepy. They might fall asleep. If they read a book, 2 pages, suddenly they're sleeping instead of reading. Or they sleep at the wheel when they're driving and have head-on collisions with people. So apnea is a very serious situation, and one of the best ways to tell, well, a head plate, you can get an indication. However, it's not the best indicator. If you have a very small pharyngeal opening, that's a sign that they might have problems. The opening should be considerably larger than this. However, one of the best ways is to see how they snore. For example, if they have complete closure, that's what we call apnea. And when you advance the mandible, it pulls the tongue forward because of the attachment to the mandible, and it opens up the airway. So suddenly they can breathe, and they might stop snoring at the same time. So this is how we control the snoring of an individual. The one appliance that we make, they're prefabricated, advances the mandible 4 millimeters beyond an end-to-end relation. The other one advances the mandible 7 millimeters beyond end-to-end. So this one is used for less severe overjets and more severe snorers. This one is used for more severe overjets and less severe snorers. If you have a 4 millimeter overjet, for example, and you advance it 4 millimeters beyond end-to-end, you're really advancing the mandible 8 millimeters, which should be enough to correct it. However, if they have a normal bite, you would be advancing at 7 millimeters beyond normal. So the two are interchangeable. However, for minimal snorers, we use this one. For major snorers and major problems, we usually use that one. These are the symptoms. Probably the most important symptom is loud, interrupted snoring. So if they have snoring that is interrupted frequently during the night, that's a sign that they have apneic events. Sleepiness during the day, lack of concentration during the day, overweight, neck size 17 inches or over in the male. 43% of adults snore. 62% of snorers are males. They often sleep on their back. Preschool children, you should be aware that 10% of young children do snore, and about 1 to 3% of them might have obstructive sleep apnea. So we, if they have an overjet, we can use our appliances to correct that. Cardiovascular risks are the risks of apnea: high blood pressure, heart attack, strokes, atrial fibrillation, diabetes. So we try it in the mouth, and we line the back with a self-cure acrylic. We sell it in a kit form with a primer, monomer, polymer, and the mixing techniques. We prime the back end of the lower part of the appliance with primer, and then we mix acrylic. Two millimeters marking, and then we mix it for about 30 seconds. We immediately load the appliance, and then we let it set for a couple minutes, and then we put it in the mouth and let it set for 2.5 minutes. It has no heat, no smell to it, no taste, and then the appliance is ready to be used. If they have interproximal space between their teeth, periodontal problems, we generally do use it on a model, but most of the time it can be done at chair side, and it takes about 10 minutes. It can be used with a C-clamp if you do it on a model, and trimmed off with a plaster knife. However, if you do load it the right way, it hardly requires any trimming at all. It can reduce snoring about 94% to 97% of the time, and it stalls the snoring about 2.5 to 3 hours, and the snoring lasts about 15 to 30 minutes when it does occur, and it's a muffling sound. Anyway, we can reduce obstructive sleep apnea about 59% down to about 15 an hour, which is not treatable generally. A machine that can be used very easily at home is called Apnea Link. You can have a little thing go into the nose. It tests the oxygenation. It records the heart, monitoring the heart, can tell you what type of apnea, how many snores, and all the information you need for it. And we don't use it for growing children. We don't use it for people that wear dentures. And if it's severe apnea, you should refer it to a physician. Some states require you to send apnea patients to physicians. I don't know if that's true in New York or not. Anyway.